one through that door. You get to be the testee, and I'm the tester. Okay, so this is how it goes. You got me?
Yep.
Hi. All right. BIO112, my name is Dr. Garais, and this is just a quick demo of your midterm checkoff would look like. It is based on week 1 and week 2 Anatomage items that you did, and you'll see if you take a good look at your midterm lab checkoff sheet, which is in your announcements, there are 10 items. So, Ms. Malhaja, if you could have that, she would enter the room, you guys would be outside, because some of the questions will be what? I'm going to change it a little bit, even though the basic questions will all be there. So, of course, she comes in the room, right? And you can have the paper down, right? She'll put your name, the date, right? And then I'll ask, Miss Maria, how do you turn on this bad boy? Okay, good. So, the first one, can she turn it on? Yes. Check, hence the term check off. Then out of all these icons, which one and how would you open up the Anatomage and the Anatomage, right? And don't help her, like if you get everything wrong, that's actually cool. That's actually you want. So where would it go? Which would you double click on, right? Well, that looks like a picture, but this is the one right here. So focus on that. It's not this one for some reason, sometimes does it, sometimes not, but this is the one. So double click on that one, click on that. And then you should see the Anatomage table logo right here, and it should come up and it should take some time. So find and select the appropriate cadaver. So you have all of these, and then we're just gonna go over, we're gonna ask her, I want female Asian, please. So can you pick, okay, she would pick gross anatomy, then she would find the female Asian, right? And then either double click on it or click and press open. So good, she has that, check, right? Okay, so Ms. Balahadja, he goes, I would like to see the posterior view, please. So how would you do that? Blink. Right. Now, boom, right? Out of these choices, did we ever talk about these two? No. So how's this? Don't touch them, right? But we talked about these three. Okay, so now back to this, right? How do I look posterior? How do I flip her over, right? Of course, it's okay, it's good. One way you can do what? Right? But if I ask specifically, I will always ask specifically because half the people will want to manually do it, which is good, of course, right? But what do we want? This one, right? And then, of course, what's the other button? Right lateral or left lateral, right? And I can press it again to do the other side. And of course, cephalic, right? Now, just for completion, and we're on the video, this will just turn the patient 90 degrees, right? Like let's say I'm like this, and I just want to turn the patient like up 90 degrees, and then I could turn the patient upside down and all these other things, right? And of course, this is the 1-to-1 aspect ratio, but it's not important. These three are important. So this is anterior, posterior, right? Lateral, and this is caudal and cephalic. So that will be the what? Utilize the orientation button. The next, it says select the visibility button. So which out of all these is the visibility tool? It's the, go ahead, the eye. Now, I will always ask something like isolate, blah, blah, blah. But typically, we're gonna, since we're gonna be doing skeletal, I'll always ask what? For this particular checkoff, skeletal, because we wanna get right to it. So kindly isolate the skeletal, and how would you do that? Good. She'd kill everything, and then of course, close out. And then, because we already know the skeletal, right? And then, if you go to the next one, select the visibility tool, select the blue dissection tool. Oh, that's another thing that I could also do. So put it back, right? And grab everything else now, and then of course close out. Can you give me a mid-sagittal view for my patient? And then the second I say view or section, right, or cutting, right, what are you starting to start thinking? You're going to start thinking, so kindly press on that. And which one is mid-sagittal? Okay, now, Now you can do what? One of two things, right? You can either do this, and then we can, we can go left to right. We can physically rotate it, right? Now, if I physically rotate it, don't you think, remember what we did in Anatomage? Doesn't it now become a cavities question? Yeah. So I could ask what cavities is what belongs where. We could do it that way. Then I could ask on the what do you call it? The blue dissection tool. I could ask, can you put it back, please? And putting it back always is this. Okay? And then let's put my patient back. Now, what's this view? If this is mid-sagittal, what's this?
Posterior anterior.
Yeah, it's a posterior anterior, but it's called a coronal. So if I say coronal section, that's the button that you press on, and it will separate you from what? An anterior and a posterior. And then the last one, right? That's your what? Transverse. So that will cut you into what? A top half and a bottom half. Okay, and that's item number 5, which is select the blue dissection tool. And then perform the proper dissection, cut, and view, which is what we did here. Now, another thing I could do is, like what we did in class, right? Hey, can you chop off the top of her head? Sure, right? And of course, I take this tool again, and it's already lit up, right? Do you see the blue? And then what do? Just draw a line, chop off the top of her head for me, please. All right, you'll do that. Then remove the thing you want to chop off, and it goes, can you rotate your patient? Remember your fingers. 1, I do what? I can move my patient on an axis, right? 2 fingers, I can move them up and down, or I can make them bigger, I can make them smaller. Right? So this, I would say, can you rotate so we can see the top of her head? You'll take 1 finger and then do what? There you go, Dr. Garais. I'm like, okay, good. And that was item number 6, perform the proper dissection, cut, and view. Okay? All right, I want to put it back. Put it all the way back. Boom. So to put things back, for the blue, always this, rewind button, that one. And for, orientation of my patient, it's always what? This one and back to the one on the top. And remember, we'll only touch these 3, right? Those are the ones that are most pertinent to what we did. Now, we went back to the select the visibility, and Miss Maria already did this for us. So let's bring her back to that part. So, select the visibility tool. She opened up, she isolated the skeletal system. She's already at number 7. So I'm gonna say, can you kindly color his femur pink, please? So the first thing you have to do, correct? She'll select the part, and then color, and then boom. And then another anatomy part, at least 2 parts, right? Can you color his ulna blue, please? Okay, yeah, you can, remember, in your lab, you can move it, do whatever, right? And that's the ulna, and she will color it blue. Okay? And he goes, and then after all said and done, okay, wonderful. And now say correct or incorrect. If you're incorrect, -5, you have another opportunity to fix it. So let's say she picked the wrong one, right? Oh, she picked the radius. Oh, it's the wrong one. Okay, it's all right, -5. Hey, you got another opportunity. Just pick the right one. Oh, I forgot, it's the other one, right? Remember, radius is which one? Thumb, ulna this one, pinky, right? And then she corrects herself, -5 only. But if she can't correct herself and can't answer the second opportunity, I have no choice. It's -10. Okay, and remember, 80 to pass. That means you only can fail 2 of these stations, or 4 minor gigs. And last but not least, Ms. Maria, can you put her all back to normal? Put all the systems back into play, and I want an anterior view.
Oh, sorry.
Okay, did that. Good. All right, and then down. And that's it. So that's 10, right? So remember, start off with 100. Any issues, we start doing what? We start taking things off. So it's at this point, right? Thank you for the video, right? Then you guys do what?